Good morning, everyone. I'm Rahul Nanpal, COO at Cureka.com, and welcome to our Instagram live session today, which is demystifying newborn baby queries. Let's start with understanding what Cureka is first of all. Cureka is an online healthcare platform to help you lead a healthy life. It is your guide to a healthy living. Today, millions of people across India come on our WhatsApp platform and ask query to our healthcare experts to understand which product is best suited for them or their family members to lead a healthy life. This could be for maternity care, baby care, skin care, hair care, pain management, or elderly care management. So let me not take much time to introduce you to our very special guest for today, Dr. Sujatha Natarajan. Good morning, Dr. Sujatha. So Dr. Sujatha, we have a session today to discuss about newborn baby problems. So a lot of parents have a lot of queries these days and they are very confused. So we are going to cover a lot of topics today. Anything you want to say to start?
Especially all moms, especially new moms, have so much concerns and doubts regarding their newborns because newborns take some time to adapt to this new environment. So during this period, they can develop some health issues, which is actually normal. You need not worry about that. But you also have to look for some danger signs. I hope this session will helpful in clearing some of your doubts.
Yeah. So let's take the first question which has come from our guests. How can parents tell if their newborn is not gaining enough weight?
Normally, newborns actually tend to lose their weight initially, like 10% of their birth weight will be reduced and then start to gain in 7 to 10 days. Especially preterm will take more than 2 weeks to gain their birth weight. This is because normally newborns will have some more amount of fluids which will get absorbed. So it will take some time for them to regain their birth weight. Afterwards, after 2 weeks, they should gain at least 30 grams per day, and then after 3 months they have to gain at least 20 grams, and after 6 months they should gain at least 10 grams per day. Normally newborns tends to gain double their weight by 4 to 5 months of age. So initially during 1 month the baby should be seen weight every week, and afterwards they can check the weight while they are getting vaccinations every month.
Okay. That's very helpful. See, just general question which comes to the mind of any parent. What is a healthy weight when a baby is born?
Normally, average weight is 2.8 kgs to 3 kgs. More than 2.5 is fine.
More than 2.5 is fine. All right. So how can parents ensure that newborn is latching correctly while breastfeeding?
Actually, we should proper position is very much important. The mother should be very much comfortable and supported, and then the baby should be held like supportively. The head and body should be straight, and the whole body should be supported. And baby's abdomen should touch the mother's abdomen, and baby's chin should touch the nipple. And the nipple as well as areola, which is a black skin around the nipple, should be entirely inside the mouth of the baby. This is the correct position for latching. Try to avoid breastfeeding while sleeping or while laying down, because sometimes while you are latching like this, some amount of milk can enter the ear of the baby and that can cause ear infection also. So try to comfortably feed the baby, and then every 2 hours once you can latch the baby.
Right. So do I need to concern about the amount of milk my baby is getting?
You need not worry unless the baby is comfortable. The baby is at least passing 6 to 8 times urine a day and at least passing 4 to 6 times stools, and the baby is alert and sleeps well. You need not worry about the amount of milk. If you feed more only, you will get more milk, and you should avoid stress and take nutritious food so that you will get more milk.
Understood. So are there any special considerations for breastfeeding when, let's say, the mother is sick or taking any medication?
Actually, breastfeeding mother should actually eat some extra calories. They should actually have 500 calories they should have in their diet, so that they can produce more amount of milk actually, and they can avoid some spicy foods, caffeine, alcohol, everything. And then they can give breastfeeding during sick sick also, but only in case if they are having some medications such as anti-cancer medications or any anti-thyroid drugs, lithium or retinoids, they should avoid breastfeeding. Otherwise, even when the mother has fever or any cough and cold, she can breastfeed the baby also. She can wear a mask when she has a cold, she can breastfeed the baby, and she can breastfeed every 2 hours once. And only in case if she has any infection in the nipple or any discharge is coming from the nipple, you can avoid breastfeeding. And in case of any cracked nipples, you can express your milk and then you can give to the baby.
Right. So guys, if you have got any questions for the doctor, you can please write in the comment and we will take them up during this session. In other case, if you have questions around any healthcare concern, you can consult with our doctors via free WhatsApp platform on www.cureka.com. So moving ahead, we have got another question for the doctor. What signs should I look for that could indicate gas and colic? What are some home remedies that we can use to soothe the baby?
Gas colic is nothing but it is due to swallowed air while baby is taking the milk. Mostly the baby might be having a intense crying. Even after comforting and feeding, the baby might cry. If a baby cries for 3 hours a day in a 3 days in a week for continuously 3 weeks, we consider it as a colic. The child will be having an inconsolable cry which can't be comforted, and the child might have a red face and they'll pass gas whenever they are crying, and their tummy will be bloated. These will be called as colic. In that conditions, we can actually, home remedies is useful. You can just comfort the baby and you can put the baby in your tummy for at least 10 to 15 minutes, and you can give a warm compression, you can give a warm bath also. In some conditions, you can give like simethicone containing drops. It will be very useful to relieve the colic, and avoid gripe water because it has no proven benefits.
Right. That I'm sure will be very helpful for the new parents. Are there any dietary changes that are recommended to help reduce, baby's gas and colic for the mother?
Now, if your baby has any symptoms of colic, you can change your diet and see for the changes. You can try to avoid some garlic, cabbage, broccoli and spicy foods, caffeine, alcohol, everything, and you can see the changes in the child also. You can avoid this, and after feeding you have to burp the child with the cupped hands like this at least for 10 minutes. This will prevent colic also.
Right. So, can I give water to the newborns? Some parents are asking.
Yeah, during the summer, many mothers will think that my newborn is dehydrated, I'm going to give water. But we need not give water till 6 months because we are already giving a breast milk which contains 90% of water. So it will also give the calories and also satisfies the thirst of the baby. You need not give water because water doesn't contain any calories, and the baby's kidney is also very immature to filter that water. Even if you are giving more water, it will reduce the sodium content and it will just harmful to the brain also. So try to avoid giving water if you are breastfeeding the baby till 6 months. Once you start complementary feeds, or in case if you are giving a formula feeds, at that time you can use a water.
Okay, right. So now, listener has asked us a question, Miss Prema. She says, what is the best way to clean and care for my baby's umbilical cord?
And it's better not to touch the umbilical cord because even if you touch the umbilical cord, you are going to give an infection to the umbilical cord. Normally it will dry and fall off by 7 to 10 days. So you need not give any care and don't apply anything on the cord. You are going to give an infection. So better not to touch that area.
Okay, right. So I'm sure you would have got your answer. If you've got any more questions for the doctor, please do mention in the comments below and we'll take them up in this session. So should I worry if my baby didn't pass stool for 5 days?
You need not worry about that because initially many mothers will be telling that my baby is passing 4 to 6 times the stools, but now it's not passing 3 to 5 days. It's passing only 3 to 5 days once. It's actually normal only because after your baby gets adapted to this breast milk, so it will actually digest the breast milk efficiently. So there is nothing to cook. So you need not worry about it unless the baby is comfortable. Yeah. In case if your baby is very irritable, you should visit a pediatrician. They can examine the child and they can prescribe any laxatives or enema. Unless that, you need not insert anything, or you should not give some castor oil anything to the baby because it is going to aggravate the problem only.
Right. I'm sure that will help a lot of parents who are having this concern. Moving on, we have got next question. Why my newborn is crying excessively?
Every newborn should be crying. Mostly crying is due to hunger. Where you have to comfort the baby and feed the baby. Then there might be any nasal block. You can give a nasoclear drops to relieve the nasal block. And you can check for any ear pain. If you touch here, this is called tragus. You can touch here and see if the baby is crying while touching here, then the baby has some infection. So you have to visit the pediatrician. And sometimes the baby might cry due to gas or colic. So at the time you can have to burp it like this for 10 minutes. And other than that, you need not worry if your baby is crying.
Yeah. And if you are really concerned, then you can also consider to
pediatrician.
Right. Yeah, visit a pediatrician. Right. So, what are the signs of an infection in a newborn baby?
Normally, the baby will start crying even after feeding. If there will be an inconsolable crying will be there. The baby's temperature either will be high or low. The baby will be very lethargic, and then the baby won't feed properly. There might be some rashes, diarrhea, vomiting. These are the signs of infection. In a newborn, if you have even one fever spike, you have to take it to a pediatrician because there is a because babies are more prone for infection, especially pneumonia, sepsis and meningitis, which is more common in this newborn. So better if you have one fever spike also, you should consult the pediatrician immediately.
Right. Sure. Right. So moving on, we have got another question from a guest saying that are there any particular health risks associated with premature babies?
Yeah, premature baby is nothing but the baby who was born before 37 weeks of gestation. Depending upon their weight and their gestation, every preterm has more concerns than the normal term babies because their lungs will be immature and they are more prone for respiratory difficulties and they are more prone for feeding difficulties because their sub-swallow coordination will be very less and they are more prone for jaundice, cardiac problems, everything. And these babies should need NICU care also till they gain 2 kgs. And birth vaccine, especially hepatitis B, should be given only when the baby's weight is more than 2 kgs. And these babies require additional pneumococcal vaccines also.
Okay.
And these babies should be properly covered because these babies tend to lose their heat and they will take some little time to gain their weight also. So preterm babies concerns are more and you have to carefully monitor the preterm babies.
Right. Do we have to consider a different diet for the baby also in terms of things?
Because we can give through palatal because direct breastfeeding can't be given to preterm babies. First we can give it via palatal, then we can gradually transition to the direct breastfeed also. But breast milk is better, but it will take some time for the preterm babies to adapt to this breastfeed also.
Right. Right. So these days a lot of babies when they're born they get jaundice, and they are treated in NICU. So what are the long-term effects of jaundice in newborns?
Jaundice during second and third day of life, we call it as physiological jaundice. Most of the jaundice doesn't require treatment, but some might be requiring phototherapy that we'll be keeping in a blue light. If the bilirubin level is high, we'll even give an exchange transfusion. This jaundice is physiological jaundice, which is actually normal. But when a jaundice is more than 14 days, then we call it as a pathological jaundice. This jaundice, the child might have a dark skin, they'll have a clay colored stools will be there, the urine will be very dark. In this condition, we have to look for some liver problems, any congenital problems and should be treated. Because if we not treat these child, then this bilirubin value can damage the brain and they can cause cerebral palsy and hearing loss also. So better to treat the jaundice early.
Right. So we have to make sure that we treat the jaundice early and look for the early signs of jaundice and consult with the pediatrician. So how do I know that the baby is hungry? Are there any signs that
we call it as cues to know that whether the baby is hungry or not. The baby might open the mouth and turn towards one side, and the baby might cry again, and the face will become red. These are the signs to know that your baby is hungry. It's better to feed for every 2 hours once, even in night also for first 3 months.
Yeah. Okay. So what signs and symptoms should I look for if I suspect my infant is having difficulty in breathing?
Yeah, you can actually check for the breathing pattern in your child. You can just count for how many breaths the child is taking for 60 seconds.
Yeah.
If the breath is more than 60 per 60 seconds, then the child has some respiratory problems, and the child may also have a noisy breathing. They can make some grunting sounds while having breathing, and they can have a widening of nostrils can be there, and then you can clearly see the retraction, that is chest bones. You can clearly see the retractions while the child is breathing, and you can see any change in the lip and fingers, toes can be changed to blue. These are the signs that your child has some respiratory problems, and you have to immediately consult the pediatrician if the child has this following signs.
Okay. So, what is the best age to start weaning my baby? What foods should a parent introduce first?
It's better to start weaning after 5 to 6 months, because till then breast milk will cover all the nutritional demand of the baby. Once the baby comes to 5 to 6 months, the breast milk supply will be also reduced, and the nutritional demand of the baby also increases. You can start complementary feeding at 5 to 6 months of age. You can first start with some rice-based cereal, ragi, kanji, everything, and smashed potatoes, peas, everything you can take. And then you can first start with 1 or 2 spoons, and then you can take it as half cup, and then you can increase to 1 cup. But while you are giving a complementary feed, you have to continue the breast milk also, because breast milk is essential for the brain development.
Right. So we have got a question coming in from a listener who says that what type of diet should I be feeding my baby? He is 3 years old but interested in playing and not eating. I tried variety of foods.
3 years old will definitely will be ignoring the food also. They'll be very playful. You can try to give, first you can start with liquids and then semi-solids. You can give fruit juices, and you can add ghee in whatever food they are eating, because it will add their calories also. And try to give egg. Either you can give a boiled egg or omelette or anything, but you should give a daily 1 egg, because egg contains more protein also. And try to avoid snacks, because if you give snacks, the child will be satisfied and will not feel hungry, so they'll try to avoid food. So try to avoid snacks and give some nutritious food. You can give even peanuts, everything, and whatever nutritious food you can give, you can give.
Right, right. So when you said eggs are good, but let's say if somebody is vegetarian, in that case, what food would be recommended to them?
Yeah, we can give soya. Soya has more protein, and you can add ghee, whatever, dal, everything which is nutritious, and vegetables, everything is very nutritious also. Vegetarians, you can add ghee in your diet, so that it will add more calories to your baby.
Right. So, are there any allergies that a parent should be aware of when introducing new foods?
Yeah, while introducing new foods, you should watch for the signs of allergies also, because many food can cause allergies, especially cow milk, egg white. Egg white can cause allergies. Even soy, wheat can cause allergy, and honey should be avoided till 1 year of age also. While introducing new foods, try to give one separate food for at least 3 to 5 days, so that if you are giving 2 to 3 foods at a time, you can't know which food is causing allergy. So try to give one food for 3 to 5 days and look for signs of allergy, such as any vomiting, diarrhea, or rash, or any fever. So you can, if you are seeing any signs of allergy, try to avoid that food, and you can try it after 1 year. Even after 1 year, the food is causing allergy, then you have to visit the pediatrician. They'll do an allergy test and find out which food is allergic for your child.
Okay. So we've got a question coming in from a guest, Rabia. And Rabia says that my baby is 4 years old. She is in UKG. Whenever she goes to school, she is vomiting within 1 hour. So got suggestions from pediatrician and gastroenterologist, gave lactobacillus syrup at home. This message is half. It says she never, but okay. So I believe she's having problem with vomiting. She has completed now. Pediatrician says she is afraid of teacher after counseling, and changed class now. 1 week she was okay. Again she starts vomiting now.
Yeah, this might be due to psychogenic vomiting. also, because if the child is comfortable in the home, but the child is vomiting in the school, it might be psychogenic. You have to change the environment of the baby, and you have to counsel the baby also, and try to not overfeed the baby also. You can leave it to her. Whatever she likes you can give, but don't overfeed the baby also. You can give this lactobacillus syrup, and then you have to get a zinc syrup also for at least 1 month, which will promote the gut bacteria also, and which will be helpful in digestion also. You have to check the weight of the baby every month. If she is losing the weight, then you have to do some investigation. If she is not losing the weight, then you need not worry about this.
Right. So better, like you have recommended, is a zinc syrup. Right?
Zinc syrup.
Okay. Understood. So doctor, there is another question. I missed my son's vaccine at 5 years. He is 9 years old now. Do I need to vaccinate him now?
Yeah, you should vaccinate him now, because whatever vaccines you have previously got, the booster is you have missed.
Yeah.
You can give the vaccines now, and then at 10 years of age, you have to give another boosters also. You have to get the vaccines.
And guys, we have another video from Dr. Sujatha herself about vaccination. Do check out that video also. That's there in our Instagram page and our YouTube page as well. And there you'll get a lot of inputs about vaccination. Yeah, I hope you got your answer. You can get your child vaccinated now as well for your booster dose. So any more questions, guys, you can ask us, and we're about to finish this session. And thank you so much, doctor, for joining us today, and I'm sure this session is tremendously helpful for parents. And guys, if you have got any topic which you want us to cover in our next Instagram lives, please do let us know. Share your ideas, comments, feedbacks in the Instagram comments, and we'll come back to you. Thank you so much, and have a good day.